Federal records tonight show 15 nursing homes in the state have been cited for infection control deficiencies since March. The State Department of Health sent out enforcement letters to those centers. Fox 59's Kelly Rinke shows us what this means for them.
In March, the Centers for Medicare and Medicaid Services suspended routine inspections of nursing homes. There's now an exclusive focus on infection control. Records show 121 of those surveys have been conducted in Indiana. 15 facilities across the state were cited with infection control deficiencies. The longest report comes from Cardinal Nursing and Rehabilitation in South Bend, where 17 people have died. Surveyors found an immediate jeopardy situation, the most serious deficiency type. They report multiple residents were exhibiting symptoms consistent with COVID-19, but were not monitored and or isolated. The report says residents began showing symptoms on March 24th. Testing was not conducted until April 12th, nearly 3 weeks later. At one point, a hospital provided the facility with 60 swabs for testing after concerns about a possible outbreak. The executive director of the nursing home said she had not followed through with the recommendation, indicating there was not enough manpower to test the residents and there was no place to move them if they were positive.
These nursing homes have high-risk individuals. They're vulnerable to infections, and so therefore we need to remain a steadfast focus on what their needs are. And
Connie Steed is the president of the Association for Professionals in Infection Control and Epidemiology. She cannot speak on these specific cases, but can provide context to these types of surveys.
COVID-19 is sort of revealed to everyone is that there are clearly vulnerabilities in the area of infection preventions and long-term care more than what was realized.
State health officials also found Westside Retirement Village in Indianapolis was not following federal requirements. Their survey report says the facility did not ensure residents who were not showing symptoms were not roomed with residents who were COVID-19 positive. Due to a lack of beds, they had to place a positive female into a room with a dementia resident who was asymptomatic and had not been tested. At least 6 people have died here. And just down the block, Brook Knoll Village was also cited for an infection control deficiency. ISDH says 4 residents were exhibiting symptoms and were not isolated.
It's criminal. That's how I feel about it. It is criminal.
Tammy Bowman's sister Kim lived at Brook Knoll until she says she passed away after testing positive for COVID-19. That was a few days after this survey.
So happy they actually went in there and it's trying to do anything to clean this up.
Kelly Rinke, Fox 59 News.